Certainly it's comforting, I guess, to some degree to have government acknowledge it. And this year we got a bit more than other regions in terms of repair and maintenance, and certainly at the time we were told it was because that our scores were the worst in terms of the facility assessments. So we've got an average of $10 million a year in repair and maintenance for our facilities, and when you consider that we have 6 million square feet and 70 discrete facilities, that's nowhere near enough. Our estimate is that we need a bolus, we need a significant investment to deal with the most critically urgent issues, and then on an ongoing basis we would need at least $50 to $60 million a year for repair and maintenance in order to keep our facilities in a reasonable condition. Correct. We would need 5 to 6 times more on a repair and maintenance, and that does not include the investment we would need up front to address the most critically urgent needs that we have, RUH being Exhibit A.
So we continue to invest in health capital, but we do have aging facilities across the province. The average age of a health facility in Saskatchewan is nearly 40 years old, which shows the extent of some of our facilities across the province. So it's something that we're not alone in Saskatchewan, and even after a significant investment of over $1.1 billion in just the last 7 years, we still have more work to do on health capital. And I think the VFA Canada president has already stated this publicly, is that this isn't just a 5 or a 10-year issue. This is something that provinces and governments over the last 50 years have really maybe haven't put a lot of attention into. I think governments of the past have been pretty good at building facilities and maybe not as well as maintaining those. And so we do have some catch up to do. We did invest $100 million in some one-time dollars in 2008. That went a long way to bringing up to date a lot of our facilities, but certainly even after that one-time injection, even after a 60% increase in this year and ongoing funding each and every year, I think it just shows the extent of some of the issues that we're still dealing with.